Good evening. So I'm here to demonstrate a medication administration video for my patient whose name is James Diamond, who is 74 years old. He has allergies to lisinopril. He has history of asthma, hypertension, bacterial pneumonia, and GERD. So the first thing I would do as a nurse before I come in the room, or before I come in contact with the patient, I'm going to wash my hands, and then I'm going to make sure that the patient is the right patient. So if the patient has a wristband, I can check his wristband, or I can ask him to verbally tell me his name, and I can also he can tell me his name, and then I can check the wristband in a mark sheet. So the patient is James Diamond. So the second thing I'm going to do is do vitals. The vital signs: his blood pressure was 142/74. His respirations was 20 beats per minute. 20 breaths per minute. Sorry. Temperature was 100.4, and O2 was 96% with productive cough. So now that the doctor's orders, his medication orders were to give the patient furosemide 20 milligrams every 6 to 8 hours, and that's for his hypertension. Acetaminophen, 500 milligram every 6 hours, or as needed for pain and fever. And we also have a macrolide azithromycin, 500 milligram on the first day, and then 250 milligram a day for 4 more days. That was the doctor's orders. So since those are the doctor's orders, I'm going to give the patient the medications. So the first thing I would do is look at the MAR sheet. So the MAR is showing me the furosemide 20 milligrams. So I'm going to check the medication and make sure that the patient name is on the medication. I'm going to read it: James Diamond, furosemide 20 milligrams every 6 to 8 hours. And I'm going to keep reading it. My second time, I'm going to read it. And then my third time, when I open it, I'm going to also read it. So we're going to do a total of 3 checks to make sure that it's the right person, it's the right medication. I'll put it in my cup, put the medication in my cup, and I'm on to the next medication, which is the acetaminophen oral medication. It's the 500 milligrams. So I'm going to, again, James Diamond, 500 milligrams, every 6 hours as needed. So this is the correct medication. Now put it inside the cup with the other med. And then last but not least, we have the macrolide, the azithromycin, which 500 milligram on this is the 500 milligrams. So this will be one tablet for the 500 milligrams, since he only gets the 500 milligram once. So this is the 500 milligram. So again, I'm gonna check, do my 3 checks. I'm gonna put that 500 milligram with the rest. So as I'm going to the patient, I'm going to tell him the medication that was prescribed, and I'm going to let him know what are they prescribed for. So Mr. James, your medication for your hypertension is the furosemide 20 milligram. It will help you with your hypertension. It will help that blood pressure to decrease. And we have some acetaminophen, which will help your temperature to go to decrease as well. And the macrolide, it will help for the bacterial pneumonia. So after, you know, we have to sit there. I will sit there as a nurse and watch him take it. Since the medication is oral medication, I will have to watch him take it. Make sure he takes it with water. And after he takes the medication, since I was the one who gave it to him, I will write in my MAR that I gave it to him at 8 o'clock a.m. That was prescribed. The time that it was prescribed. That it was given. Sorry. It was 8 a.m. I just initialed that by all three medications. So after I finish my documentation, I will go back in and tell him, teach him some things about the medication. So the furosemide, I will instruct him so his healthcare professional regards to diet high in potassium, instruct him to take the medication directed. Any missed dose, take as soon as possible and do not double dose on that. And for the acetaminophen, I will advise patients to take medication exactly as directed and not to take more than the recommended amount. Advise patients to avoid alcohol, and if the rash occurs, discontinue the acetaminophen. And for the azithromycin, I will tell him to that he have to finish the drug. Even if he is feeling better, he have to finish every dose of it. All the doses, the 4 days that he have the medication, he have to complete it even if he's feeling okay. Instruct the patient to not take azithromycin with food or antacids, and it may cause drowsiness and dizziness. And advise patients to use sunscreen protective clothing to prevent photosensitivity reactions. So once I tell the patient that would be the end of my video. And I will check the patient, come in and check his vitals in an hour to see if the medication worked. If it did work, then and no reactions, or if it didn't, I will report it to the physician if anything looks abnormal. Thank you.